Dr. Corey Maas. We're going to be talking a little bit about fractional laser resurfacing today. There are many brands out of the technology fractional laser resurfacing, and people have heard of Fraxel and a number of others, including Active and ActiveFx, which is the technology that we'll be using. Without getting into the details today, there are big differences in the technology. There are big differences in the cost to the physician buying these pieces of equipment, and a lot of those decisions have a big impact on which piece of equipment. My personal feeling about fractional laser is the Active and ActiveFx machine provides the best outcomes with the least amount of discomfort, and that's why we've got it. It's a big investment. It's 2 or 3 times more expensive than some of the original devices that are out there, so a lot of docs choose not to use these devices. What we're going to be doing today is treating a very good patient. We're going to be doing an ActiveFx section. ActiveFx is a treatment that, again, fractionates the laser, meaning the entire surface area of the skin is not treated. We're able to control with a computer chip that's in this handpiece the amount of energy that's delivered, the size of the spot of energy that's delivered, and we're going to leave a lot of the normal skin intact and undamaged, which speeds the recovery and healing time. So that's the key thing about fractional laser resurfacing, is that we're able to control the area of injury. In the older methods of resurfacing, dermabrasion or chemical peels, the entire surface of the skin was injured. With fractional resurfacing, we are taking a small fraction of the surface and injuring it, but still stimulating the same wound healing response that improves wrinkles, lines, and dyschromias, the browns and reds that occur in our skin surface. So without much more to be said, we're going to move on and get back to
So in preparation for fractional laser resurfacing of the face or any other area, we have the patients come in about an hour in advance. We'll clean their face or have them wash their faces and clean all the makeup off or sand, debris, whatever they have on their faces. And we will get ready by applying a layer of topical numbing anesthesia. We use a combination of betacaine, tetracaine, and lidocaine. People are allergic to one of those, we'll just use straight lidocaine, and that sits on the face for about an hour. It's a very effective topical numbing agent. Some people want a little Valium if they're nervous. It's really not necessary, but if they want some mental nerve block here, and we're going to do a little infraorbital nerve block. Pinch here, Barbara. And I use a very small little needle of insulin syringe, so it really reduces the sting, so it's not so dramatic for the patient. And then I'll do a supraorbital nerve block right by the brow, a little pinch here. And that gets pretty much 90% of the facial anesthesia taken care of. There are a couple areas around the chin and ear that might be a little sting, and in the temporal fossa region where the greater, where the auricular temporal nerve comes up. So we're just doing little focal points. A lot of people do lots of injections in this area, and that's not completely necessary.
The pattern is visible here that we're laying down for the patient, and we can set the patterns to be different things, squares or circles, but when I'm covering the face, the idea is fractional laser is leaving a interval or a treatment area, and then there are intervals between those treatment areas. There's some skin that is untreated, and then the fractional or thermal injury is that where the small white dots are seen, which are basically vaporized skin cells. How you doing, Barbara? There we go. Little stinger at the end.
That's it?
That's it. Real-time treatment with fractional laser resurfacing, and we're going to apply now a topical product called Biofine that helps. So we use this just the first day, and then we switch over to a product that I use. And we tell patients that within 5 days, typically, sometimes a little less, sometimes a little more, they can apply makeup and get back to their normal business. Final results with any type of resurfacing are seen really at about 6 months.